Today we want to talk about a very important topic, that is about the Nigerian public health system. The Nigerian public health system. Recently we've had stories where a first year undergraduate of the University of Port Harcourt was denied treatment in Lagos University Teaching Hospital, and also where a nurse working in one specialist hospital in Zamfara slumped and died, and so many other stories. The title of this video is Nigerian Public Health Institutions or Hospitals of Death. We record more deaths there. Most of them are avoidable deaths. First, let's talk about the University of Port Harcourt students that died in Louth. Because of, for some of us, Louth stands for Lagos University Teaching Hospital. Now, from the story published in Punch newspaper, it was said that the student was denied treatment, in the hospital because of the issue of bed space. I want to use this medium to state that it is criminal, it is unconstitutional, it is illegal in a tertiary hospital for the staff to deny a patient access to emergency medical treatment by virtue of the fact that there is no bed space. Such thing is unheard of. Let's go to relevant laws. Section 20, subsection 1 and 2 of the National Health Act states that no health worker, health provider, or health establishment has the power to refuse a patient, a user, emergency medical treatment for any reason. When we say any reason, we are talking about bed space, we are talking about issue of payment deposit. This is important. I will talk about other ones later in my video, but this one is important because it is like a recurring decimal. It's something that occurs from time to time in Nigeria. If you go to Code of Medical Ethics, it classifies health institutions into different cadres or categories. Now, the teaching hospital, that is, if you go to Rule 14, subsection 4A, it defines a teaching hospital that it is the apex of health institutions. The apex means the topmost, means the highest. For some of us that are not in the health sector, you will understand that what do I use to make you understand the position of teaching hospital? The position of teaching hospital is like the Supreme Court. That is the final in terms of our courts. It is the highest authority in healthcare institutions. And if you go to that Rule 14, subsection 4A, it defines a teaching hospital as the one that has the highest level of subspecialties, the highest level of specialties, and so on and so forth. It is extremely important. That's why in that section 14.4a, it says people don't come there without a referral note. You should come there with a referral note because it's a referral center. It's the apex referral center in the country. The only condition, if you go to that section 14.4a, it's the only condition where you can go to teaching hospital without a referral note is for people that are admitted through the accident and emergency. That one, you don't require referral note. I am quoting exactly what it is in that Rule 14, subsection 4A of the Code of Medical Ethics. So you find out that if this is the apex, this is the final solution to healthcare problems. I wonder why somebody will say there's no bed space. If there's no bed space, then you should not be there. I've mentioned the section 20 subsection 1. Subsection 1 says you have no reason for a health worker or health institution or healthcare provider to deny a citizen, to deny a Nigerian, to deny a user any emergency medical treatment. There's no reason whatsoever. If you go to some hospitals now, some teaching hospitals, tertiary hospitals, if they don't tell you there's no bed space, they will tell you to make payments. And in some of them, in that payment, now we are drifting towards cashless economy. Now, some of these people may not have the cash. Okay, let us consider a scenario where there was a road accident and good Samaritans brought the person. They never knew this person from Adam. They brought this person. Our current tertiary hospitals, as they are constituted, will demand deposit. You must get the card. If you don't get the card, then no treatment. The nurses will tell you, doctor will not see you. Where do you want him to write? These are unnecessary bureaucracies. Now, this person is unconscious. We don't know how to contact the people. The passers-by brought this person to a government-owned hospital. Now, if we insist on collecting money before treatment is given to a patient in emergency cases, in emergency cases, tell me the money that federal government sends to each federal government-owned hospitals and the one that state government sent to the state-owned public hospitals, what do they use this money for? And I must tell you that health institutions are one of the institutions that do not remit money to the federal government. So when you are talking about internally generated revenue, they don't generate anything. Rather, they are the ones that collect. Most of the bills in our public hospitals are even bigger than what you get in private hospitals. Yes, but we already have this notion that private hospitals are costlier than the public hospitals. So, a student was denied treatment and the person died in lieu. So let this be a warning. Subsection 2 of that section 20 Act punishes a situation where a staff or health institution denies a citizen emergency medical treatment for any reason. The punishment is 100,000 when convicted, or prison term of not more than 6 months. That's what we call simple offense in law. Please, you have no right. If you know you don't have bed spaces, enough bed spaces, resign. In a tertiary hospital, you must resign. We must get things right. Resign. Because we always hear where associations go on strike because of their salaries. Yes, I'm not saying that you are paid well, but you will also go on strike when bed spaces are not enough. In the next video, we are going to talk about the legal implications of the deaths that died in the course of our duty in Zamfara Specialist Hospital.
Preview.
Please remember to comment, like, subscribe, and share. Thank you.